Online students, what we have completed on Saturday?
Normal laboratory.
Okay, of which laboratory test? Serum sodium,
Potassium,
potassium,
then coagulation study, मतलब APTT, PTI,
yes, and
last platelet.
platelet, yes. So till now we have completed serum sodium, potassium, APTT, PTIN, and platelet count. Okay, so let's do a quick revision. Uh, we have completed sodium. What is the normal value of sodium?
135 to 145.
135 to 145.
135 to 145 milli-equivalent per liter. In which conditions hypernatremia occurs?
Dehydration, impaired renal function, increased dietary or IV intake of sodium, primary aldosteronism.
Okay, so elevated values occurs in dehydration, impaired renal function, increased dietary or IV intake of sodium, primarily aldosteronism, and use of corticosteroids. You don't have to mug it out. Just use the rational thinking ki why in this the sodium elevates. So when you are solving the question and answers, you will be provided four options. In that four options, four conditions will be given. So you have to boost your mind, or you have to boost your thinking in according to that. In this condition, does sodium elevates or not? If no, then eliminate that option. So you have to think according to this. Then hyponatremia occurs in which conditions? Insipidus. Okay.
Water intoxication,
Water intoxication.
then sodium intake IV through अधिक.
Yes, sodium intake is less than. That is water intoxication. Addison's disease, decreased dietary intake of sodium, diabetic ketoacidosis, diuretic therapy, excessive loss from the GI tract, excessive perspiration, water intoxication, and you have said that diabetic insipidus that also causes hyponatremia. Then we have seen what are the components of whole blood. So there is plasma and formed elements. Plasma contains proteins, waters, and other solutes. Which types of proteins? So there are albumin, globulin, fibrinogen, and prothrombin. They are not going to ask you about the components of blood. This is for your knowledge, for your understanding. What are the solutes that are present in the plasma? So that is gases, electrolytes, nutrients, regulatory substances, waste products. What are the formed elements? So there are platelet, WBCs, and RBCs. What are the types of WBCs? So there is neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So these are the components of whole blood. Okay, so then we have completed how to obtain a blood sample from peripheral IV line and central line. Okay, the red important point that you have to remember is
Prolonged use of tourniquet,
which electrolyte imbalance occurs due to excessive tying of tourniquet.
pseudo-hyperkalemia.
Yes, hyperkalemia. Yes. So first of all, the type of solution that we are infusing in the patient can alter the lab values. Secondly, long-term use of tourniquet before blood sampling can create high elevated potassium, that is false pseudo hyperkalemia can occur, and it leads to inaccurate results of the patient. Then next is serum potassium. What is the normal value of serum potassium? Yeah, online
3.5
student. 3.5 to 5 milli-equivalent per liter. Then we have seen in which conditions the potassium gets elevated. You have to just simply rationalize these things. The conditions in which the potassium level drops down, that is hypokalemia. Then we have seen APTT. What is APTT?
Coagulation.
Yes, it is a coagulation test. And which drug APTT is used for which specific drug?
Impairing.
heparin. What is the normal range of ABTT? 30 to
30 to
40 seconds.
40.
If the patient is on anticoagulant therapy, then what will be the ABTT range?
It could
If
be
the
between 1.5 and 2.5 times.
times more than 30 to 40 seconds, yes. We have to multiply 30 or 40 into 1.5 or 2.5. So that will be the normal range for the patients who are taking heparin therapy. If the patient is taking heparin therapy, then at what time you have to withdraw the blood sample?
Before 1 hour of second dose.
Yes, before 1 hour of second scheduled dose. Okay. Then the important point that you have to remember is
If patient on heparin therapy to longer than 100 seconds.
yes, if the patient is receiving heparin therapy and the ABDT value is more than 100 seconds, so you have to put that patient in bleeding precautions. Or the patient who is at risk for thrombocytopenia, their ABDT value is more than 100 seconds, so still you have to put that patient into the bleeding precautions. If the normal healthy individual has ABDT more than 40, then yes, again, bleeding precautions. You have to put that patient in bleeding precautions. More than 100 seconds is only for the patient who are receiving heparin therapy or who are thrombocytopenic. Understood?
Yes.
Okay. Next is PT-INR. What is that? It is also a blood coagulation study test. It is mainly used for which drug?
Warfarin.
Warfarin. Yes, warfarin. And what is the normal value of PT?
11 to 12.5.
11 to 12.5 second. What is the normal value of INR?
Point
0.8 to 1.2.
0.8 to 1.2. Yes. No seconds or no unit. It's a just value, that is 0.8 to 1.2. Because it's a ratio. There is no any unit for that. And uh, what is the normal, we can say if the patient is receiving the warfarin therapy, then what is the normal range?
for PT 1.5 to 2 times.
1.5 to 2 times more than normal range. We have studied this in pharmacology. Okay. So what is the important point that you have to remember?
If patient is in warfarin therapy and PT is value is longer than 25 seconds and INR greater than 3.0, then bleeding precaution. Levan.
Yes, we have to put that patient in the bleeding precaution. If the patient is not receiving any warfarin therapy and still their value is more than 12, 13 seconds or more than 1.5 seconds, then
Also put in bleeding
yes,
precaution.
also we have to put that patient in the bleeding precautions. More than 25 and 3 is only for the patients who are receiving warfarin therapy. If the patients who is receiving warfarin therapy and their PT value is 22 and INR is 2.5,
Normal.
It's
then it's a
normal.
normal. Yes, we don't have to put that patient in a bleeding precautions. If the value is greater and there are bleeding risk, what interventions you will do?
Stop the medication.
Stop the medication, warfarin, then
Or the PSCP.
yes, notify the PSCP, and third step,
Or
Take
step.
bleeding precaution.
initiate bleeding precautions. But yes, what you will anticipate, what the PSCP will give the orders?
Prepare anticoagulant.
No,
Oh.
anticoagulants are going on. That's why the patient, we have put
Yes,
that.
right.
So what you will do? Anticipatory action. Patient पेशेंट को वार्फरिन चल रहा था, उसकी वैल्यू 25 सेकेंड, पीटी की वैल्यू 25 सेकेंड से ज्यादा आई, आईएनआर की 3 से ज्यादा आई, आपको पता चल गया कि पेशेंट को ब्लीडिंग रिस्क है, आपने वार्फरिन स्टॉप कर दिया, दैट इज द गुड थिंग, दैट इज द फर्स्ट स्टेप। देन आपने बीएससीपी को नोटिफाई भी कर दिया और आपने खुद से ही पेशेंट को ब्लीडिंग प्रिकॉशंस पे रख दिया, यू विल नॉट डू एनी एक्टिविटी दैट कॉजेज ब्लीडिंग टू द पेशेंट, सो यू हैव आल्सो इनिशिएटेड ब्लीडिंग प्रिकॉशंस। देन आप क्या अज्यूम करोगे, डॉक्टर्स आपको क्या ऑर्डर देंगे, what you will anticipate?
Antidote
Yes, antidote. So you will prepare
for
Vitamin
impairing
K.
protein.
vitamin K is the antidote for warfarin. So you will prepare the vitamin K administration. You will not administer without orders, but you will prepare that syringe vitamin K administration to the patient whenever the doctor gives you order. You have to just simply administer that to the patient. That is the anticipatory action. Understood what I'm trying to say?
Yes, ma'am.
Yes. Next, another condition, another situation is patient who is receiving heparin therapy and their APTT value is more than 100 seconds. So what are the nursing interventions that you have to follow?
Top medication called
Of
PSCP and
medication?
protamine sulfate ready રાખવાનો.
Yes, then inform the PSCP, put the patient in bleeding precautions and prepare the protamine sulfate medications. The doctor will give the orders to give the antidote because the medication overdose has occurred to the patient. So these are the interventions. You have to work like this. Okay. Next, we have completed platelet count. What is the normal range of platelet?
1,50,000 to 4,50,000.
Yes, 1,50,000 to 4 lakh or 4,50,000. In which conditions the platelet becomes elevated, that we have seen. In which conditions the platelet becomes slow, that we have seen. The great important point that you have to remember is
પેશન્ટ કીમોથેરાપી લેતી હોય તો પ્લેટલેટ ક્લોઝલી મોનિટર કરવાના because risk of thrombocytopenia.
yes, if the patient who are receiving chemotherapy, there is risk of thrombocytopenia because of bone marrow suppression. So you have to check for thrombocytopenia and check for bleeding also. Then
Then અગર કોઈ ઇન્વેઝિવ પ્રોસિજર અથવા બાયોપ્સી કરવાની હોય તો એની પહેલા પ્લેટલેટ કાઉન્ટ સ્ટડી કરી દેવાના.
platelet count and other
કોગ્યુલેશન સ્ટડી.
coagulation studies like APTT, PDNR. So if the patient is having any invasive procedure like biopsy or thoracentesis, we have to do the coagulation studies and platelet count before doing that procedure. So this is the important point that you have to remember. Any doubt till this?
No.
Okay, so let's start. The new another lab value, that is hemoglobin and hematocrit. Hemoglobin is the main component of erythrocytes and serves as a vehicle for transporting oxygen and carbon dioxide. Hemoglobin is situated in the RBCs, that is erythrocytes, and the main function of hemoglobin is
Oxygen
yes, to transport oxygen and CO2. That is the main function of HB, hemoglobin. Hematocrit means, what is hematocrit? I have already make you understand about hematocrit. What is that?
જે આરબીસીમાં માસ કહી શકે ને આપણે એનું વોલ્યુમ કહી શકીએ.
Yes, the number of RBCs or the volume of RBCs. For example, there are beaker 1 and beaker 2. Can you see this? So there are two beakers, beaker 1 and beaker 2. So in the first beaker, there are, we can say 10 RBCs unit. So these are the RBCs. And beaker 2, there are 20 RBCs. So there is much more RBCs. So hematocrit value is higher in which beaker? Beaker 1 or beaker 2? Yes, beaker 2, because there are more number of RBCs. So hematocrit represents the RBC mass and is an important measurement in the presence of anemia or polycythemia. Through hematocrit, we can identify the patient is having anemia or polycythemia. What is anemia?
લો આરબીસી કાઉન્ટ.
Low RBC.
No.
Low
Low
HB.
Yes,
Low H.
decreased level of HB. But why the HB has reduced? Because there is lack of RBCs.
RBC.
RBCs has decreased in number. So due to that reason, the HB is also low. So we can identify the anemia. And what is polycythemia?
Higher concentration of RBC.
Yes, more number of RBCs, higher concentration of RBCs. Okay, so let's see the table 10.2, the normal hemoglobin and hematocrit reference level. So hemoglobin altitude dependent. Why it is written as altitude dependent?
કેમ કે જેમ આપણે ઉપર જઈએ ને એમ આપણને ઓક્સિજન ઓછું મળે.
Yes, so
તો
what
આરબીસી
is
વધે, આરબીસી એ ટાઈમે વધે ફોર કમ્પન્સેશન કેમ કે ઓક્સિજન તો હોય નહીં બોડી.
हाँ, जब हम हायर ऑल्टीट्यूड्स पर जाएंगे ऑक्सीजन का लेवल कम होता जाएगा. सो अवर बॉडी डज अ कंपेंसेट मैकेनिज्म एंड इट प्रोड्यूसेस मोर नंबर ऑफ आरबीसीज. As the RBC production increases, the hemoglobin also increases, which can carry more oxygen to the blood, to the tissue. So it is altitude dependent. So for male, the normal hemoglobin range is 14 to 18 gram per deciliter, and for female, it is 12 to 16. We can say it is changed as a book per book. Then, for example, the normal HB level of female is 12 to 14, and for male, it is 14. 15 to 16 or 14 to 16, it is like that. So it depends on the author or books, the value became changed. So you have to just simply remember the range of the HB, that is, this is the normal range. You can combinedly remember like this: the normal range for hemoglobin is between 12 to 18. So any value that comes between 12 to 18 is normal range for male or female. What is the normal value of hematocrit? The normal value for male is 42% to 52%, and for female it is 37 to 47%. This is the normal range. You have to also add this normal value in your chart, and you have to stick this at your study table. Okay. So next is fasting is not required for this test. If you are checking for hemoglobin and hematocrit, there is no need to make the patient on fasting or NPO. Elevated values occurs in the following. In which conditions the hemoglobin and hematocrit does get elevated? So hemoglobin elevated in COPD. Why?
કેમ કે બ્રીથિંગ પ્રોબ્લેમ છે તો ઓક્સિજન નહીં હોય બોડી.
Yes, because it is chronic obstructive pulmonary disease. There is lack of oxygen. So body will try to produce more RBC, and again it leads to high level of HB. High altitudes that we have already discussed, and polycythemia. All these conditions leads to high level of hemoglobin. Next is hematocrit. In which conditions the hematocrit does get elevated? So first is dehydration. How?
કેમ કે પ્લાઝમા નહીં હોય એટલે.
Yes, that is, जब फ्लूइड लॉस हो जाएगा तो फॉर एग्जांपल दोनों बीकर है, दो बीकर है, एक में 10 ml वाटर है और 10 यूनिट आरबीसी है, और सेकेंड बीकर में ओनली 5 ml वाटर है और 10 आरबीसी है. सो इन विच द आरबीसी concentration is higher, the hematocrit feels higher, so that is the beaker 2. There is normal level of hematocrit, but due to dehydration the concentration will rise. So the hematocrit value elevates in dehydration, higher altitudes, as the RBC production increases, and in the condition that is polycythemia. Below the normal value occurs in the following. कब hemoglobin और hematocrit decrease होगा? So hemoglobin decreases in anemia. Hemorrhage, bleeding होगा, blood loss हो जाएगा, तो HB भी down हो जाएगा patient का. Hematocrit भी कब loss हो जाएगा? So patient is anemic. बोन मैरो फेलियर, बोन मैरो में से आरबीसी बन ही नहीं रहे हैं, तो हिमेटोक्रिट कैसे होगा ज्यादा? हेमरेज, पेशेंट इज सफरिंग फ्रॉम ब्लड लॉस. ल्यूकेमिया. व्हाई ल्यूकेमिया? ल्यूकेमिया मींस
immature WBC count.
yes, there is leukemia means lack of WBCs, but which WBCs will be lack?
Mature.
Mature. There is lack of mature WBCs, but there are lots of immature WBCs in the bone marrow, which inhibits the production of healthy platelets and RBCs. So in these conditions, hematocrit will decrease, and overhydration. Overhydration means there is a fluid overload. So due to that, the hematocrit will be diluted. So that's why the hematocrit value will be reduced in overhydration. Understood?
Yes.
Yes.
Okay. Next lab test is lipids. So blood lipids consist of primarily cholesterol, triglycerides, and phospholipids. There are mainly three types of lipids: cholesterol, triglycerides, and phospholipids. Lipid assessment includes total cholesterol, high density lipoprotein, low density lipoprotein, and triglyceride. जब भी हम पेशेंट का ब्लड टेस्ट करेंगे, लिपिड असेसमेंट करेंगे, डॉक्टर ऐसा बोलेंगे कि पेशेंट का लिपिड प्रोफाइल चेक करो. So in that lipid profile, what you will include? So total cholesterol is there. You will include total cholesterol, high density lipoprotein, low density lipoprotein, and triglycerides. These are the tests that you will include in a lipid profile assessment or lipid assessment. Cholesterol is present in all body tissues and is a major component of LDL, brain, nerve cells, cell membranes, and some gallbladder zones. कोलेस्ट्रॉल कहाँ पर होता है? मेनली सारे बॉडी टिश्यूज में कोलेस्ट्रॉल होता है एंड इट इज अ मेजर कंपोनेंट ऑफ एलडीएल. लो डेंसिटी लिपोप्रोटीन होता है, उसमें कोलेस्ट्रॉल ज्यादा होता है. वो ब्रेन पर भी होता है थोड़ा थोड़ा, हेल्दी टाइप ऑफ कोलेस्ट्रॉल. सो ब्रेन में भी देखने को मिलेगा, नर्व सेल्स में भी देखने को मिलेगा, सेल मेम्ब्रेन्स पर भी होगा, एंड सम गॉल ब्लैडर स्टोन्स. गॉल ब्लैडर स्टोन्स आर ड्यू टू, गॉल ब्लैडर स्टोन्स क्यों होते हैं?
Fat.
यस, फैट की वजह से. नॉर्मली व्हाट इज द फंक्शन ऑफ गॉल ब्लैडर?
Storage of bile.
Storage of bile. When the bile stays in the gallbladder for longer time, it sediments and creates the stone. So in some gallbladder stone, there is a presence of cholesterol. Low density lipoprotein transports cholesterol from the liver to the tissue of the body. What is the function of LDL? It transports the cholesterol because cholesterol is the major component of LDL. So the LDL transports the cholesterol from liver to the tissues of the body. We know that the liver breaks down the fat and stores the fat in itself. So whenever there is need, the LDL will transport that cholesterol from the liver to other tissues, other parts of the body. Triglycerides are synthesized in the liver from fatty acids, proteins, and glucose are obtained from the diet. जब भी हम खाना खाते हैं, like fatty acids जो भी फैट के फॉर्म में होता है, प्रोटीन, सो उसमें से ट्राइग्लिसराइड कौन सिंथेसाइज करता है? लीवर. वो जब खाना खाएंगे तो उसका ब्रेक डाउन करेगा, लीवर में से एंजाइम्स निकलेंगे जो ब्रेक डाउन करेगा, लाइक बाइल्स और वो सब ब्रेक डाउन करके ट्राइग्लिसराइड्स फॉर्म करेंगे. और ग्लूकोज भी कहाँ पर सिंथेसाइज होगा? इन द लीवर. वी नो दैट देयर इज अ नीड, the glycogen is stored in the liver and glycogen breakdown होगा और बॉडी को ग्लूकोज मिलेगा. सो वो कहाँ पर स्टोर हो रहा है? सब कौन कर रहा है? लीवर. देयर इज अ कंडीशन, जब जो भी पर्सन हो वो ज्यादा शुगरी फूड खाएगा तो उसका लीवर कैसा हो जाएगा? सो व्हाट इज दैट कंडीशन?
Fatty liver.
Fatty liver occurs due to oily food. There is a word, non-alcoholic fatty liver disease. This occurs due to two reasons: high consumption of sugar and high consumption of fatty foods. So that the liver is the main source for storage of glucose and conversion of glucose and the triglycerides. Increased cholesterol levels, LDL levels, and triglyceride levels place the client at risk for coronary artery disease. जब भी कोई पेशेंट का हम लिपिड प्रोफाइल चेक करें और उसके लिपिड प्रोफाइल में कोलेस्ट्रॉल भी इंक्रीज हो गया है, एलडीएल भी इंक्रीज हो गया और ट्राइग्लिसराइड भी इंक्रीज हो गया, तो उसकी वजह से क्लाइंट को किसका रिस्क ज्यादा होगा? कोरोनरी आर्टरी डिजीज का. द आर्टरीज विल गेट ब्लॉक्ड ड्यू टू दैट प्लेक फॉर्मेशन. HDL helps protect against the risk of coronary artery. High density lipoprotein is a good cholesterol and low density lipoprotein is bad cholesterol. So if the high density lipoprotein is elevated, it helps the arteries to remain clean. It protects the artery from blocking up. It protects against the risk of coronary artery disease. So HDL is good, but LDL, cholesterol, and triglycerides are not that much good. Instruct the client to abstain from food and fluid except for water for 12 to 14 hours and from alcohol for 24 hours before the test. जब भी किसी पेशेंट का लिपिड प्रोफाइल टेस्ट करना हो तो हमें पेशेंट को एडवाइस करना होगा कि आपको कुछ भी खाना नहीं है बिफोर 12 to 14 hours of the test. It means कि पेशेंट को रात से ही एनबीएम पर करना है बट नॉट completely. Patient is allowed to consume water only, no any food. And we have to advise the patient, if the patient is taking alcohol, then we have to advise the patient not to consume alcohol before 24 hours of the test, because alcohol consumption and the food consumption will alter the normal range of cholesterol, LDL, triglycerides. So we have to advise this to the patient. Instruct the client to avoid consuming high cholesterol food with the evening meal before the test. We know that we will put the patient on NBM before 12 hours. But 12 hours से पहले जो खाना खा रहा है पेशेंट, तो उसमें भी पेशेंट को बोलना है कि हाई फैटी फूड ना ले, लाइक फ्राइड फूड्स और वैसा कुछ ना ले जिसकी वजह से टेस्ट में रिजल्ट्स में ऑल्ट्रेशन आए. सो पेशेंट को बोलना है कि नॉर्मल लो फैट फूड डाइट, जो नॉर्मल डाइट लेते हो वही लेना है. फ्राइड फूड और हाई फैटी फूड नहीं कंज्यूम करना है. और देन 12 to 14 आवर्स से आपको सिर्फ वाटर ही कंज्यूम करना है. Okay, normal reference intervals is given in table 10.3. So the normal lipid profile is cholesterol is less than 200 mg per dl. The ideal value is below 200. If it is 200 or more than 200, then there is a risk of
coronary artery
coronary artery disease.
disease.
So cholesterol should be less than 200 mg per dl. High density lipoprotein, that is the good cholesterol, it should be more than 60 mg per dl. If it is less than 60, then there is a risk of coronary artery disease, because there is no high amount of HDL which can protect the arteries from blocking up. So it should be always more than 60 mg per dl. Low density lipoproteins are bad proteins, so it should be less than 100 mg per dl. And triglycerides, for male there is between 40 to 160 mg per dl, and for female it is between 35 to 135 mg per dl. If it gets elevated, then there is a risk of coronary artery disease. Understood?
Yes.
Okay. So elevated values occurs in the following. In which conditions the values will get elevated? If high density lipoprotein gets elevated, then
Also
it's
was
a good thing. No, it's a good thing. So
हाँ,
yes, we will always check the elevated value of cholesterol, LDL, and triglyceride, because that is causing the harm to the patient. HDL will not cause any harm to the patient. So in which conditions the cholesterol and LDL becomes high? So first is biliary obstruction. There is no extra bile to break down that. So due to the biliary obstruction, the biliary circulation, the hepatic circulation for the bile secretion has obstructed due to stone or anything. Cirrhosis hyperlipidemia. Cirrhosis hyperlipidemia means
Fatty liver.
yes, the liver has become cirrhosed due to high lipid levels. So that is cirrhosis hyperlipidemia. Hypothyroidism. How?
metabolism decrease
Yes. In hypothyroidism, the metabolism has reduced. So there is not enough breakdown of the fatty food. It leads to high level of cholesterol and LDL. Idiopathic hypercholesterolemia. What is that? Idiopathic.
કોલેસ્ટ્રોલ તો વધે છે બટ એનું રીઝન અનનોન છે કે કેમ વધે.
Yes. There is a high level of cholesterol, but reason we don't know why the levels are high. So that is called as idiopathic hypercholesterolemia. Renal disease. Due to some inflammatory reactions, there is increased level of cholesterol and LDL. Uncontrolled diabetes. Oral contraceptive use. This is, you have to remember, oral contraceptive use will increase the risk of
હાર્ટ એટેક.
But how?
કેમ કે ટ્રાઇગ્લિસરાઇડ વધી જશે ને.
Yes. It elevates the triglyceride, cholesterol and LDL level, and there is a risk of thrombus formation. So you have to remember this. Next is triglyceride. In which conditions the triglyceride levels become high? So first is diabetes mellitus, hyperlipidemia. There is high level of lipids in the blood, hypothyroidism, and liver disease. So these are the reasons in which the triglyceride level become elevated. Below the normal value occurs in the following. अब कोलेस्ट्रॉल और एलडीएल कौन सी कंडीशंस में कम हो जाएगा? एक्सटेंसिव लीवर डिजीज इतना एक्सटेंड हो गया है कि वो नॉर्मल प्रोडक्शन जो होना चाहिए वो हो नहीं रहा. So in that condition the cholesterol and LDL becomes low. In hyperthyroidism because there is much more metabolism, so जितना भी है वो यूटिलाइज हो जाएगा. माल न्यूट्रिशन, पेशेंट खाना ही पूरा नहीं अच्छे से नहीं खा रहा, सो माल न्यूट्रिशन की वजह से यूज ऑफ कॉर्टिकोस्टेरॉइड थेरापी. कॉर्टिकोस्टेरॉइड थेरापी की वजह से भी कोलेस्ट्रॉल और एलडीएल कम हो जाएगा. ट्राइग्लिसराइड्स कैसे वर्क करेंगे? सो कौन सी कंडीशन में ट्राइग्लिसराइड कम हो जाएंगे? सो देयर इज हाइपरथायरॉइडिज्म, माल एब्जॉर्प्शन सिंड्रोम एंड माल न्यूट्रिशन. पेशेंट इज नॉट कंज्यूमिंग ऑल द न्यूट्रिएंट्स right in a right proportion, so there is lack of triglyceride. Can someone tell me how corticosteroid therapy can reduce the cholesterol or LDL? Okay, let me give you one hint. हमने अभी पढ़ा कि कोलेस्ट्रॉल सारे बॉडी टिश्यूज में है. क्यों है? Okay, why you are applying moisturizer on in winters, during winters? Moisturizer is something oily substance, so why you are applying that?
સ્કિન ડ્રાય થઈ જાય.
ડ્રાય થઈ જાય એટલે.
Prevent the dryness.
Skin gets dry. So cholesterol is required in a normal range for healing of the cells. Whenever there is an inflammatory process, the cells get damaged. So for their healing, cholesterol is required, but in a normal range. If it gets high, it produces the risk of coronary artery disease. So lower range are not all acceptable. We should need the cholesterol and triglycerides in a normal healthy range. If it gets severely down, then there is no healing property of the cell. So tell me, in corticosteroid use, how the cholesterol and LDL level reduces? There is a link between this.
આપણે કોર્ટિકોસ્ટેરોઇડ ઇન્ફ્લામેટરી રિએક્શનને રિડ્યુસ કરવા માટે આપીએ, ધેટ્સ વાય થતું હશે.
Yes. Corticosteroids, what is the action of corticosteroid? It decreases the inflammatory response, immune system gets down. So there is no need of cholesterol and LDL will be utilized by the cell. So due to that reason, the cholesterol and LDL level gets down. Understood?
Yes.
Yes,
Okay.
ma'am.
Okay, next lab value, that is fasting blood glucose, FPS. Glucose is a monosaccharide found in a fruit and is formed from the digestion of the carbohydrates and the conversion of glycogen by the liver. Glucose कहाँ से मिलता है? वो monosaccharide है. We have all studied in the chemistry like monosaccharide, disaccharide, polysaccharide. So glucose is the monosaccharide, basic form. Monosaccharide is the basic form. ग्लूकोज वो मोनोसेकेराइड है. कहाँ से मिलता है? सो फ्रूट में होता है. और जब भी हम कार्बोहाइड्रेट्स खाते हैं उसका ब्रेक डाउन होगा, डाइजेशन होगा. सो कार्बोहाइड्रेट का ब्रेक डाउन होकर पॉलीसेकेराइड, डाइसेकेराइड एंड लास्ट में जो प्रोडक्ट मिलेगा वो ग्लूकोज होगा. दैट इज अ मोनोसेकेराइड. सो कार्बोहाइड्रेट्स खाने से मिलता है, फ्रूट्स खाने से मिलता है. और जब भी एक्स्ट्रा जो ग्लूकोज है वो लीवर स्टोर करेगा इन फॉर्म ऑफ ग्लाइकोजन. सो whenever there is a need, वो ग्लाइकोजन डिवाइड ब्रेक डाउन होके ग्लूकोज बन जाएगा. सो ग्लूकोज कहाँ से मिलता है? फ्रॉम फ्रूट्स, from carbohydrates, from the digestion of carbohydrates, and from the glycogen which is stored by the liver. Understood? Glucose is the main source of cellular energy for the body and is essential for brain and erythrocyte function. जो ग्लूकोज है वो मेन सोर्स ऑफ एनर्जी है, हमारे बॉडी के सारे सेल्स की एनर्जी कौन है? ग्लूकोज है. एंड इट इज वेरी एसेंशियल फॉर ब्रेन एंड इरिथ्रोसाइट फंक्शन. अगर ग्लूकोज डाउन हो जाएगा तो ब्रेन फंक्शन कैसा हो जाएगा? ऑल्टर. यस, हमने देखा है कि जब भी हाइपोग्लाइसेमिया होता है तो फर्स्ट साइन क्या होगी?
confusion,
कंफ्यूजन. बट हमने नॉर्मल लाइफ में भी देखा है कि किसी का ब्लड ग्लूकोज कम हो जाता है तो क्या होता है?
कॉन्शियसनेस ऑल्टर हो जाती है, मतलब lack
कॉन्शियसनेस
of
ऑल्टर हो जाएगी, डिजीनेस हो जाएगा, चक्कर आ जाएगा, बिकॉज ब्रेन को वर्क करने के लिए एनर्जी नहीं मिल रही. सो फर्स्ट ऑफ ऑल वी गिव the glucose to that patient. So it is very essential for brain. If the patient is in hypoglycemia, severe hypoglycemia can lead to coma. So it is very essential for brain and erythrocyte functioning also. Fasting blood glucose levels are used to assist in diagnosing diabetes mellitus and hypoglycemia. एफबीएस जो वैल्यू है, हम एफबीएस क्यों चेक करते हैं? एफबीएस चेक करने से हमें पता चलेगा कि पेशेंट को डायबिटीज है या हाइपोग्लाइसीमिया है. वो आइडेंटिफाई करने के लिए, वो डायग्नोस करने के लिए हम एफबीएस टेस्ट करते हैं. Instruct the client to fast 8 to 12 hours before the test. The name suggests fasting blood glucose. So there is a requirement of fast. तो हमें पेशेंट को बोलना होगा कि जब भी आप एफबीएस टेस्ट कराओ उससे पहले 8 से 12 घंटे तक आपको कुछ भी नहीं खाना. यू हैव टू डू फास्ट. Instruct a client with diabetes mellitus to withhold morning insulin or oral hypoglycemic medication until after the blood is drawn. अगर कोई पेशेंट डायबिटिक ही है और उसका एफबीएस करना है, तो हमें उसको बोलना तो होगा फर्स्ट ऑफ ऑल यू हैव टू रिमेन एनबीएम. And you have to also advise that patient to not take the morning insulin or morning oral hypoglycemic agents, that is the diabetes medications. We have to advise the patient not to take any food or any medication until the blood is drawn. After the withdrawal of blood, patient can eat food and can take the medications, but before taking blood the patient cannot eat food or cannot take the medications or insulin. What is the normal value of blood glucose, fasting blood glucose? Online student, what is the normal value of fasting blood glucose? It is between 70 to 99 mg per dl. In USA, they use SI unit, that is 3.9 to 5.5 millimole per liter. But in examination, you will be always asked in mg per dl. But in USA, in their hospitals, they use SI unit, that is 3.9 to 5.5 millimoles per liter. In which conditions the fasting blood glucose becomes high? So during acute stress, we know during stress the body will require more energy and the glucose production will be higher. So during acute stress, cerebral lesions, Cushing syndrome. How does Cushing syndrome leads to high elevated level of glucose?
કેમ કે સ્ટીરોઇડ વધી જશે તો ઇફેક્ટ તો હાઇપરગ્લાઇસેમિયા.
Yes. Cushing syndrome, in Cushing syndrome, there is a high level of steroids which leads to hyperglycemia. Diabetes mellitus, hyperthyroidism, pancreatic insufficiency. Pancreatic insufficiency में इंसुलिन सिक्रीटी नहीं हुआ तो ग्लूकोज ज्यादा हो जाएगा. इन विच कंडीशन द पेशेंट एक्सपीरियंसेस हाइपोग्लाइसेमिया? कौन सी कंडीशंस में ब्लड ग्लूकोज कम हो जाता है? सो देयर इज एडिसन्स डिजीज, लैक ऑफ स्टीरॉइड्स. हिपैटिक डिजीज होगा क्योंकि उसमें एक्स्ट्रा ग्लूकोज स्टोर ही नहीं होगा, देयर इज नो ग्लाइकोजन. सो ड्यूरिंग हिपैटिक डिजीज ब्लड ग्लूकोज कम हो जाएगा. हाइपोथायरॉयडिज्म में, इंसुलिन ओवरडोजेज में, पेनक्रियाटिक ट्यूमर होगा तब. देन पिट्यूटरी हाइपोफंक्शन, पोस्ट डंपिंग सिंड्रोम. व्हाट इज दैट पोस्ट डंपिंग सिंड्रोम?
वो जब આપણે ગેસ્ટ્રિક કટ કર્યું કે જ્યારે આપણે કહી શકીએ ને શોર્ટ કર્યું એ ટાઈમ.
Okay. Yes, when the patient has undergone any surgery that we have done anastomosis, in during that the patient will experience dumping syndrome. Next, sometimes patient experiences dumping syndrome in a normal situation as well. So what is dumping syndrome? I'm asking about that. Dumping syndrome
Rapidly,
is,
Yes.
Rapid
rapidly
stomach
empty
ગેસ્ટ્રિક
the
એમ્પટિંગ
stomach.
જલ્દી થઈ જાય.
હા
yes, rapidly emptying of stomach content. That is called as dumping syndrome. So after dumping syndrome, the patient blood glucose will be down. So these are the reasons which leads to hyperglycemia and hypoglycemia. Okay. Next lab value, that is glycosylated hemoglobin, HbA1c. Any idea what is this?
હા 3 મહિના પહેલા 3 મહિનાનું મતલબ ગ્લુકોઝ ચેક કરવા.
Okay. Any
બ્લડ
idea?
ડ્રોન કરીને આપણે ગ્લુકોઝ લેવલ ચેક કરીએ છીએ 3 મંથ્સની એવરેજ કાઢવા માટે.
Yes. Fasting blood glucose will provide you the idea about that specific time. Right now, what is the level of patient's blood glucose? But with the use of HbA1c, you can get the idea of the 3 months average. That during past 3 or 4 months, patient का blood glucose कितना रहा है, कितना नॉर्मल रेंज में था, कितना ज्यादा था, कितना कम था, उससे आपको 3 मंथ्स का ब्लड ग्लूकोज स्टेटस पता चलेगा. तो HbA1c is a blood glucose bound to hemoglobin. What is HbA1c? The full form is glycosylated hemoglobin. So the glucose that is binded to the hemoglobin. Through this test, we can identify, we are withdrawing the blood and we can identify that how much glucose is bounded to the hemoglobin. Hemoglobin A1c or glycosylated hemoglobin A or HbA1c, we can say anything. But HbA1c is a reflection of how well blood glucose levels have been controlled for past 3 to 4 months. HbA1c टेस्ट से हमें पता चलेगा कि कितनी अच्छे से पेशेंट का ब्लड ग्लूकोज कंट्रोल में रहा है, प्रॉपर नॉर्मल मैनर में, हेल्दी मैनर में कितना कंट्रोल अमाउंट में था ब्लड ग्लूकोज. फास्टिंग इज नॉट रिक्वायर्ड बिफोर दिस टेस्ट. अगर क्लाइंट का HbA1c ब्लड टेस्ट करना है तो उसके लिए फास्टिंग रिक्वायर नहीं है, कभी भी आप कर सकते हो. बट द नॉर्मल रेफरेंस इंटरवल इज लेस देन 5.7. ऑलवेज मेक श्योर कि HbA1c वो 3 मंथ्स का ब्लड ग्लूकोज टेस्ट होगा. सो द नॉर्मल वैल्यू ऑफ HbA1c इज ऑलवेज लेस देन 5.7%. If patient का HbA1c value is between 5.7 to 6.4, 5.7 to 6.4 की बीच में आता है patient का HbA1c. So what does it indicates? It indicates the pre-diabetes. What is pre-diabetes? Pre-diabetes means?
ડાયાબિટીસ થવાની સ્ટાર્ટ થયું છે.
Yes, there is a risk that the patient will get diabetes if the patient does not take any action. So that is pre-diabetic state. The patient has no diabetes. Patient को diabetes नहीं होगा है, पर अभी ऐसा ही चलता रहेगा तो patient को कभी भी diabetes हो सकता है. That is the pre-diabetic state. So patient का 3 महीने का blood sugar ज्यादा रहा है तो कभी भी उसको diabetes आ जाएगा. And the level of 6.5 or more, that indicates the diabetes. अगर patient का HbA1c आपने टेस्ट किया और उसका HbA1c 6.5 आया है और उससे ज्यादा है तो इट कंफर्म्स कि पेशेंट को डायबिटीज ही है, उसका ब्लड शुगर अच्छे से मॉनिटर नहीं हो, कंट्रोल में नहीं है, ज्यादा ही है. सो देर आर द रेंज. Ideally, it should be less than 5.7. If it is 5.7 to 6.4, then it is called as pre-diabetes. If it is more than 6.5 or it is more than 6.5, then it indicates diabetes. So you have to remember all three this range. Understood?
Yes.
Yes. Within 5.7 to 6.4 pre-diabetes range, the higher your HbA1c, the greater you risk for developing the type 2 diabetes mellitus. उसमें ऐसा बोल रहा है कि जितना 5.7 to 6.4 there is a range of pre-diabetic clients. So जितना आपका उस रेंज में ज्यादा होगा, if the client HbA1c value is 6.3, so उसको ज्यादा रिस्क है कभी भी डायबिटीज टाइप 2 आ जाने के, डेवलप होने के. Or if it is 5.7, then there is a much less risk. But patient needs to control their blood glucose. It indicates that there is a risk. Patient को कभी भी diabetes हो सकता है, अभी हुआ नहीं है, but there is a risk. Understood?
Yes.
Yes. Elevated values occurs in the following. कौन सी कंडीशन में HbA1c ज्यादा आएगा? So non diabetic hyperglycemia. What is that? Non diabetic hyperglycemia?
જેને ડાયાબિટીસ તો નહીં બટ એને શુગર હાઈ છે.
Yes. Patient has not diagnosed with diabetes. उसको अभी diabetes diagnose नहीं हुआ, पर उसका blood glucose is high. So that is called as non-diabetic hyperglycemia. Poorly controlled diabetes mellitus. क्लाइंट को डायबिटीज है और क्लाइंट प्रॉपरली मेडिकेशंस भी नहीं ले रहा है, प्रॉपर डाइट भी फॉलो नहीं कर रहा है. पुअरली कंट्रोल्ड डायबिटीज. सो ड्यूरिंग दिस कंडीशंस HbA1c level will be higher. Below the normal values occurs in the following. कौन सी conditions में HbA1c will less? So chronic blood loss. Chronic blood loss क्यों? Because majority of this glycosylated blood glucose is bound with hemoglobin. So due to blood loss, there will be lack of hemoglobin. So there will be lack of glycosylated glucose. Then chronic kidney disease. In the chronic kidney disease, what happens? It is related to something, a hormone called as erythropoietin.
ઇરિથ્રોપોઇટિન નહીં હોય એ ટાઈમે એટલે પછી આરબીસી નું પ્રોડક્શન નહીં થાય તો
Yes.
અલ્ટિમેટલી
HB nahi hoy. Yes. In chronic kidney disease, the main function of kidney is also to produce the erythropoietin hormone, which is responsible for the production of RBC. If the kidneys are not functioning well, there will be lack of erythropoietin hormone, which leads to decreased production of RBCs, which leads to decreased level of hemoglobin, and again it leads to there is a lack of glycosylated glucose, which is bound to hemoglobin. So in this condition, there is a lack of the value of HbA1c will be less during pregnancy, because majority of glucose is metabolized by mother and for the fetus. So during pregnancy, the HbA1c value can be lower. And sickle cell anemia. Sickle cell anemia, there is no healthy RBCs. सिकल सेल अनीमिया में आरबीसीज का शेप कैसा होता है? सिकल शेप्ड होता है. यस, there is no healthy RBCs, so there is no enough of HB and there is no glucose bound to that enough level of HB. So these are
Madam,
the reasons. Yes.
pregnancy gestational diabetes भी થાય ને?
Yes, pregnancy માં gestational diabetes હશે, પણ HbA1c ની વેલ્યુ લો આવી શકે છે. એ 3 months નો એવરેજ છે.
Okay.
Yes. HbA1c and estimated average glucose reference intervals. So there is a table 10.4. We can see the normal values of HbA1c or also the estimated average glucose. HbA1c is also called as estimated average glucose. Ultimately, we are finding the average of 3 or 4 months. So let's see the table. HbA1c, there is a percentage. The normal, that is less than 5. Normally, HbA1c is less than 5.7%. So in table form, they are giving percentage. 6, 5 is healthy. 6 is we can say that is pre-diabetic. 7 is diabetic, and 8, 9, 10 is severe diabetes. It is very worst control of diabetes. So there is a table in percentage. We can say estimated average glucose and estimated average glucose in mg per dl and millimole per. This is conventional unit. This is SI unit. So EAG, the value of EAG in conventional unit is different. If it is 100, it can say as healthy. If it is 126, it is pre-diabetes. If 154, then it is diabetic. Then these are poorly controlled. There are worst form of diabetes. Similarly, EAG 5.57, then it is healthy. 7, then it is pre-diabetic. 8.6, then it is diabetic. And these are worst uncontrolled diabetes. Understood? You have to remember this. The important is only this. You have to remember only 3 ranges. That is less than 5.7, between 5.7 to 6.4, and more than 6.5. So this is healthy, this is pre-diabetic, and this is diabetic. You have to just simply remember this. In examination, अगर वो आपको पूछेंगे कि patient का HbA1c 6.8 आया है, so what you will do as a nurse? 6.8.
Pre-diabetic.
Diabetic.
6.8.
Diabetic patient.
Yes,
Diabetic.
diabetic. So you have to advise the patient for lifestyle modifications. You have to refer the patient to the endocrinologist. They will prescribe some medications to control the blood glucose. First of all, you have to always go with the lifestyle modifications. Then the patient is not following the proper diet and not doing lifestyle modifications. Then the doctor will prescribe the medications. But you should understand the patient is diabetic or pre-diabetic or patient is healthy. So you have to always remember these three range.
મેડમ
Exam,
ટાઈપ
yes.
ટાઈપ 2 ડાયાબિટીસમાં HbA1c greater than 6 જ હોય.
Yes, ડાયાબિટીસમાં greater than 6.5 જ હોય ત્યારે જ ડાયાબિટીક હોય.
એમને
Is-
ટાઈપ 2 ની વાત કરું.
હા, સો ટાઈપ 1 કે ટાઈપ 2 બંનેમાં શુગર તો વધારે જ હશે.
એમને HbA1c ની વાત કરું મેડમ.
હા, એ વધારે જ આવે.
એટલે ઓછું ના રેન્જ થાય એમ કહું. મેનેજ ના કઈ ટાઈપ 2 ડાયાબિટીસ રિસ્ક વધી
હા.
જાય 6 થી.
ના ના ના, લેટ મી ક્લિયર યુ. જો પેશન્ટને ડાયાબિટીસ છે પણ એ મસ્ત રીતે મેનેજ કરે છે, એકદમ પ્રોપરલી ઇન્સ્યુલિન લે છે, મેડિકેશન્સ બી લે છે અને ડાયટ બી એનું સારું છે, લાઈક પ્રોપર એની હેલ્ધી લાઈફસ્ટાઈલ છે, સો એનું 5.7 to 6.4 ની વચ્ચે આવશે બીકોઝ એ પ્રોપરલી મેનેજ કરે છે. ધો હી ઇઝ ડાયાબિટીક, એનું મેનેજમેન્ટ સારું છે. અન્ડરસ્ટુડ?
યસ.
હા, એ મેડિસિન્સ ને એવું બધું લેશે તો એનું પ્રી ડાયાબિટીક રેન્જમાં જ આવશે બીકોઝ એ બધું જ પ્રોપરલી લે છે. તો એવું અગર કોઈ ક્લાયન્ટને ઓલરેડી ડાયાબિટીસ ડાયગ્નોઝ થયું છે, પછી એને મેડિકેશન્સ આપી દીધી છે, બધું આપી દીધું છે અને એની રેન્જ 5.7 to 6.4 માં આવે છે, ઇટ ઇન્ડિકેટ્સ કે પેશન્ટ બહુ જ સારી રીતે એનું બ્લડ ગ્લુકોઝને મેન્ટેન કરે છે, પ્રોપર ડાયટ ફોલો કરે છે, પ્રોપર મેડિકેશન્સ લે છે ટાઈમ ટુ ટાઈમ ને બધું જ પ્રોપર ફોલો કરે છે. સો દેટ ઇઝ ધ ગુડ થિંગ. Okay? Yeah. Online students, please come back from break. Should we start now?
Yes.
Okay. So
Yes.
next lab, yes. Next lab test is renal function studies. Just like liver function studies, we have renal function studies. So how you will assess the function of renal? There are various types of blood tests through which you can identify the renal function. So in renal function studies, the first blood test is serum creatinine. So what is that? Creatinine is a specific indicator of renal function. क्रिएटिनिन है वो एक स्पेसिफिक इंडिकेटर है रीनल फंक्शन कैसा है. अगर क्रिएटिनिन हाई है इट मींस कि रीनल फंक्शन अच्छा नहीं है, पुअर हो गया है. सो थ्रू क्रिएटिनिन यू कैन आइडेंटिफाई अबाउट द रीनल फंक्शन. Increased level of creatinine indicates the slowing of glomerular filtration rate. अगर क्रिएटिनिन हाई हो गया है, बढ़ गया है, तो वो क्या इंडिकेट करता है कि जो ग्लोमेरुलर फिल्ट्रेशन होना चाहिए वो अच्छे से हो नहीं रहा है, स्लो हो गया है. जैसे जैसे क्रिएटिनिन बढ़ेगा वो स्लोइंग में से कंप्लीटली स्टॉप हो जाएगा. जब जब ग्लोमेरुलर फिल्ट्रेशन रेट धीरे धीरे स्लो होता जाएगा, क्रिएटिनिन बढ़ता जाएगा. एक एंड आ जाएगा कि किडनीज कंप्लीटली डैमेज हो गए हैं, ग्लोमेरुलर फिल्ट्रेशन हो ही नहीं रहा. सो क्रिएटिनिन विल बी सीवियरली हाई. Instruct the client to avoid excessive exercise for 8 hours and excessive red meat intake for 24 hours before the test. जब भी किसी पेशेंट का क्रिएटिनिन टेस्ट करना होगा, सो वो पेशेंट को हमें पहले से ही एडवाइस करना होगा कि not to do excessive exercise before 8 hours and not to consume red meat before 24 hours. Why? What is the rationale behind this?
કેમ કે રેડ મીટ એ મતલબ મેસી સોર્સ છે પ્રોટીન, તો પ્રોટીન વધી શકે.
Yes. Creatinine क्या है? What is creatinine?
એ વન ટાઈપ પ્રોટીન જ છે.
It is a waste product of protein. So creatinine is a type of protein we can say. तो जब भी कोई पेशेंट एक्सेसिव विगरस एक्सरसाइज करेगा, तो एक्सरसाइज करने से मसल वियर एंड टियर होता है. So muscles are majorly formed
બાય પ્રોટીન.
by protein. So उसमें से प्रोटीन एक्स्ट्रा लीक होगा और उसमें से वेस्ट प्रोडक्ट दैट इज क्रिएटिनिन एक्स्ट्रा फॉर्म होगा. अगर पेशेंट रेड मीट कंज्यूम कर रहा है, रेड मीट इज नॉट चिकन एंड नॉट फिश, except for chicken and fish all are called as red meat like bacon, beef, दिस कॉल्ड एज अ रेड मीट. तो कोई भी पेशेंट अगर रेड मीट कंज्यूम कर रहा है बिफोर टेस्ट 24 आवर्स से पहले, सो उसका भी क्रिएटिनिन हाई आएगा. So we have to advise the patient that not to do exercise before 8 hours and not to consume red meat food before 24 hours. What is the normal value of creatinine for male? It is 0.6 to 1.2 mg per dl, and for female it is 0.5 to 1.1 mg per dl. You can combinedly remember like this: 0.5 to 1.2. So in this value both male and female are combined 0.5 to 1.2. So you have to remember this normal range of creatinine. Add this in your chart. Elevated values occurs in severe renal disease. Creatinine कब high हो जाएगा? जब severe renal disease होगा. Renal kidneys proper function नहीं कर रही, kidneys में से creatinine filter out नहीं हो रहा, तब creatinine बढ़ जाएगा. Below normal values occurs in the diseases with decreased muscle mass such as muscular dystrophy and myasthenia gravis. क्रिएटिनिन कब कम होगा ब्लड में? तो कोई ऐसे डिजीज हो जिसमें मसल मास ही कम हो जाता है, बिकॉज हमने अभी देखा कि मसल इज द मेजर सोर्स, इज मेजरली फॉर्म बाय द प्रोटीन्स, एंड जब भी हम यूज करते हैं मसल्स उसमें से क्रिएटिनिन रिलीज होगा, प्रोटीन रिलीज होगा. पर किसी कोई पर्सन है जिसका मसल मास ही नहीं है, सो इन द कंडीशंस लाइक मस्कुलर डिस्ट्रॉफी, व्हाट इज दैट?
મસલ્સ ની સાઇઝ ના હોય જેમ
Yes. The person is not using that limb or that part of the body, so due to the lack of usage the muscle will get diminished, dystrophy हो जाएगा. Just in the movie that is बाहुबली, उस मूवी में जो बताया कोई पर्सन उसका शोल्डर है ना, उसको मस्कुलर डिस्ट्रॉफी हुआ बताया. सो दैट इज द मस्कुलर डिस्ट्रॉफी. एंड व्हाट इज मायस्थेनिया ग्रेविस?
मसल्स कंट्रोल ना रहे.
Yes. So that is the involuntary lack of muscle control. So that is called as myasthenia gravis. So in these conditions, the creatinine level will be low, below the normal range. Okay. Next renal study, that is BUN. Urea nitrogen is the nitrogen portion of the urea, a substance formed in the liver through an enzymatic protein breakdown process. जब भी प्रोटीन का ब्रेकडाउन होता है, सो लीवर में से एक एंजाइम निकलता है, दैट इज द यूरिया नाइट्रोजन. सो व्हाट इज BUN? ब्लड यूरिया नाइट्रोजन. जब भी प्रोटीन का मेटाबॉलिजेशन होता है तो लीवर में से एक एंजाइम निकलता है, दैट इज द यूरिया नाइट्रोजन. Urea is normally freely filtered through the renal glomeruli with a small amount of reabsorbed in the tubules and remainder excreted in the urine. जो ये यूरिया बना प्रोटीन का ब्रेकडाउन करने के लिए, जो यूरिया वेस्ट प्रोडक्ट बना है, मेजरली वो यूरिया किडनीज में से एक्सक्रीट आउट हो जाएगा. स्मॉल अमाउंट ऑफ यूरिया वो रीएब्जॉर्ब होगा. ब्लड में थोड़ा यूरिया चाहिए तो थोड़ा पोर्शन रीएब्जॉर्ब होगा, बाकी का मेजरली वो एक्सक्रीट हो जाएगा. BUN and creatinine ratio should be analyzed when the renal function is evaluated. जब भी हमें renal का function test करना हो, only on the basis of BUN we cannot identify directly the renal function. Why? सिर्फ और सिर्फ BUN के टेस्ट पर से हमें रीनल का फंक्शन पता नहीं चल सकता. Why?
કેમ કે બીયુએન બીજા માટે કેમ કે ડિહાઇડ્રેશનમાં બી બીયુએન વધી શકે, લીવરની કોઈ કન્ડિશન છે એમાં બી BUN વધી શકે.
Yes. BUN is not directly linked with the renal function. There are many more conditions in which the BUN level can be high. So we can test the ratio of BUN and creatinine through which we can identify the renal function. Or there is another test that is creatinine. So combinedly we can check the renal function test, but not only on basis of BUN we cannot identify the renal function. The normal reference of BUN is 10 to 20 mg per dl. You have to remember this normal value. Elevated values indicates the slowing of glomerular filtration rate. If the kidneys are damaged, then the elevated levels can indicate there is a slowing of glomerular filtration rate. Kidneys का function जो filtration करना है वो कम हो गया है, तब BUN high आता है. But elevated values occurs in the following. कौन सी conditions में values high हो जाती है? So in burns, How? Burns?
કેમ કે સેલ ડેમેજ થાય તો એની એન્ડ પ્રોડક્ટ યુરિયા જ બની શકે.
No, 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 no. Due to dehydration. Because burns में हम पहले क्या करते हैं? Fluid resuscitation करते हैं. Due to burns, there is a cell damage and loss of fluid through the skin. बहुत सारा fluid loss हो जाता है. That's why we have to do the first intervention, that is fluid resuscitation. So loss of fluid leads to elevated UN level. Dehydration, again loss of fluid. GI bleeding हो रहा है, again loss of fluid. Increase in protein catabolism, that is fever and stress. जब प्रोटीन ज्यादा ब्रेक डाउन होगा तो ज्यादा वेस्ट प्रोडक्ट क्रिएट होगा, लाइक फीवर और स्ट्रेस में बॉडी की नीड ज्यादा हो जाएगी और प्रोटीन ब्रेक डाउन बढ़ जाएगा. रीनल डिजीजेस में भी BUN हाई होगा. शॉक, व्हाट टाइप ऑफ शॉक?
હાઇપોવોલેમિક.
Hypovolemic.
Shock, yes. Urinary tract infection. So all these are the conditions which leads to elevated value of BUN. Below the normal value occurs in the following. BUN की value कब कम हो जाएगी? Less than 10. So that is fluid overload. Dilute हो जाएगा. जो blood में यूरिया नाइट्रोजन है वो सारा dilute हो जाएगा. So when fluid overload, malnutrition, proper न्यूट्रिशन ही नहीं ले रहा पेशेंट, प्रॉपर प्रोटीन इनटेक ही नहीं है, सो प्रोटीन का ब्रेकडाउन करके कितना यूरिया, ब्लड यूरिया फॉर्म होगा, सो दैट इज माल न्यूट्रिशन. सीवियर लीवर डैमेज, लीवर ही डैमेज है. We know that during the breakdown process of protein, the enzyme, that is the blood urea nitrogen, is formed in the liver, but liver ही डैमेज है तो वो enzyme ही नहीं फॉर्म होगा. Syndrome of inappropriate anti-diuretic hormone, what is that?
ADH વધારે હશે તો water
SIADH.
retention.
Yes, ADH, there is much more ADH, which leads to
water retention એટલે
water
hypervolemic.
retention.
Pressure થઈ જાય.
Yes, so due to that, the blood urea will get diluted. So in these conditions, there is the lack of BUN levels. Understood? Okay. Okay, next, that is the last lab value, that is WBC. WBC count. WBC functions in the immune defense system of the body. We know WBC, what is the main function of WBC? Is to provide the immune defense to our body. It works as a defense system. वो कोई भी infection के कुछ भी होता है, so उसमें fight करने के लिए help करता है. The WBC differential provides specific information on WBC types. We know doctors are suggesting like a differential test. आपने कभी ऐसा टेस्ट देखा है? TLC, DLC? कभी सुना है डॉक्टर ने बोला हो TLC करवा लो, DLC करवा लो?
total leukocyte count.
Total count
Yes,
difference.
total leukocyte count. What is leukocyte?
WBC.
WBC. So generalize. What is the total WBC count? So what is the normal value of WBC?
8,000 to 11,000.
5,000 to 10,000. Yes, 5,000 to 10,000. That is the total leukocyte count. And what is DLC?
Differentiate leukocyte count.
Yes, differential leukocyte count. What does that mean? आपने किसी का भी ब्लड रिपोर्ट देखा होगा, सो डीएलसी के अंडर ऐसा सब लिखा होगा. मोनोसाइट्स कितने हैं, इओसिनोफिल्स कितने हैं, न्यूट्रोफिल्स कितने हैं. यस, सो दिस आर द डिफरेंशियल ल्यूकोसाइट्स काउंट. दैट मींस कि डब्ल्यूबीसी में भी हमने पढ़ा है कि बहुत सारे टाइप्स है. सो कौन से टाइप का मोनोसाइट कितना है, इओसिनोफिल कितना है, बेसोफिल कितना है, न्यूट्रोफिल्स कितने हैं. सो टू आइडेंटिफाई दैट, द डॉक्टर्स आर डूइंग डिफरेंशियल ल्यूकोसाइट काउंट. सो डब्ल्यूबीसी डिफरेंशियल से हमें स्पेसिफिक टाइप ऑफ डब्ल्यूबीसी की इंफॉर्मेशन मिलती है कि कौन से टाइप ऑफ WBC इंक्रीज हो गया है और डिक्रीज हो गया है. सो उसका पता कैसे चलेगा? थ्रू द डिफरेंशियल काउंट, दैट इज द DLC, differential leukocyte count. A shift to left, this is so important, you have to understand. There are two types of count, we can say a shift to left. A shift to left in the differential means that an increased number of immature neutrophils are present in the blood. अगर किसी डॉक्टर ऐसा बोले कि किसी के रिपोर्ट में ऐसा लिखा हो देर इज अ शिफ्ट टू लेफ्ट, तो उसका मतलब क्या होता है कि देर आर हाई नंबर ऑफ डब्ल्यूबीसी, बट विच टाइप ऑफ डब्ल्यूबीसी? immature WBCs which are of no use because वो immature है, उसका हम क्या करेंगे? So the immature WBCs are much more higher and this condition is called as shift to left of WBCs. Next, a low total WBC count with a left shift indicates a recovery from bone marrow depression or an infection of such intensity that the demand of for neutrophils in the tissue is higher than the capacity of bone marrow to release them into the circulation. अगर ये शिफ्ट टू लेफ्ट वाला WBC है उसका काउंट लो हो गया है, सो व्हाट डज इट इंडिकेट? इट इंडिकेट्स दैट बोन मैरो जो डिप्रेशन हो गया है वो अब ठीक हो गया है, बोन मैरो का फंक्शन सप्रेस हो जाएगा, तो वो प्रॉपर मैच्योर WBC नहीं बना सकता है बोन मैरो, वो इमेच्योर ही बनाकर छोड़ देगा. सो देर इज द डिप्रेशन ऑफ बोन मैरो. बट अगर शिफ्ट टू लेफ्ट वाला कम हो गया है, उसकी वैल्यू कम हो गई है, जो WBC हाई हो गए थे, जो इमेच्योर WBC वो अब कम हो गए, सो व्हाट डज इट इंडिकेट? कि जो डिप्रेशन हो गया था बोन मैरो का वो अभी रिकवरी कर रहा है, अभी अच्छा होने लगा, इसलिए अभी सब मैच्योर होने लगे. देर आर नो हाई नंबर ऑफ इमेच्योर WBC, तो अब वो कम हो गया है. और बॉडी में कब इमेच्योर WBC बढ़ जाते हैं? जब बॉडी में इन्फेक्शन हो गया हो और बॉडी डिमांड करती हो कि वी नीड मच मोर WBC, but bone marrow is not capable enough to make produce a large number of WBCs in a very short period. So bone marrow क्या करेगा? फटाफट से immature WBCs रिलीज करना स्टार्ट करेगा. सो कोई ऐसी कंडीशन हुई हो, कोई ऐसा इन्फेक्शन हुआ हो कि जिसमें न्यूट्रोफिल की डिमांड बहुत ज्यादा हो, देन द कैपेसिटी ऑफ द बोन मैरो, तो उस टाइम पे इमेच्योर WBCs बहुत हाई हो जाएंगे. पर उसमें अगर इमेच्योर WBCs लो हो जाए तो उसका मतलब क्या है कि पेशेंट भी इन्फेक्शन से भी रिकवर कर रहा है. अंडरस्टूड व्हाट दिस पॉइंट इज सजेस्टिंग यू? पता चला? ओके. A high total WBC count with a left shift indicates increased release of neutrophils by the bone marrow in response to an overwhelming infection or inflammation. अगर ये shift to left shift वाला जो WBC है वो अगर हाई हो गया तो what does it indicate? कि अभी bone marrow भी proper अच्छा नहीं है, वो bone marrow भी डिप्रेशन है और पेशेंट को कुछ ऐसा इन्फेक्शन हुआ है कि जिसकी वजह से बोन मैरो ज्यादा इमेच्योर WBC प्रोड्यूस कर रही है फॉर द इन्फेक्शन और इन्फ्लामेशन इन दैट रिस्पॉन्स. अंडरस्टूड? should I repeat or do you get my point?
Please repeat करो मैडम one time.
Yes, okay. We know कि immature WBCs कौन सी कंडीशन में हाई हो जाते हैं? जब बोन मैरो डिप्रेस हो तब immature WBCs हाई हो जाते हैं. और सेकेंड रीजन इज जब बॉडी में इंफेक्शन और इन्फ्लामेशन हो गया है बट दैट इज सो सीवियर, so it gives order to the bone marrow to release more WBCs, but this will be immature because bone marrow does not have enough time to make it mature. So due to that infection or inflammation that has overwhelmed, बहुत ज्यादा इन्फेक्शन और इन्फ्लेमेशन हो गया है, उसकी वजह से बोन मैरो ज्यादा न्यूट्रोफिल्स रिलीज करेगी इन द ब्लड. सो इट विल लीड टू हाई टोटल WBC. बट कौन से WBC हाई हो जाएंगे? लेफ्ट शिफ्ट वाले WBC. एंड व्हाट इज दैट? शिफ्ट टू लेफ्ट मींस व्हाट? Yes, there are much more high number of WBCs, but these are immature. वो immature है. Should I explain in Gujarati? ઓકે. પેશન્ટને ઇન્ફેક્શન થયું છે, બહુ જ બધું ઇન્ફેક્શન થયું છે બોડીની અંદર. સો બોન મેરો શું કરશે? એ ઇન્ફેક્શનને ટ્રીટ કરવા માટે પ્રોડક્શન WBC નું પ્રોડક્શનનું કામ કોનું છે? બોન મેરોનું.
Bone
સો
marrow.
યસ, જે ઓવરવેલ્મિંગ ઇન્ફેક્શન ઓર ઇન્ફ્લામેશન થઈ ગયું છે એને ઓવરકમ કરવા માટે WBCs બહુ જ બધા બોન મેરો છે બહુ બધા WBCs ફોર્મ કરશે, પણ કેવા હશે WBCs? immature WBC. Yes. तो તો એની વેલ્યુ તમે બ્લડ ટેસ્ટ કરશો તો વેલ્યુ તો હાઈ જ આવશે, પણ એ કેવા છે? ઇમેચ્યોર છે. સો હાઈ વેલ્યુ ઇન લેફ્ટ શિફ્ટ એ શું ઇન્ડિકેટ કરે છે? લેફ્ટ શિફ્ટ જે છે, શિફ્ટ ટુ ધ લેફ્ટ, એની વેલ્યુ વધારે આવે છે. એનો મતલબ શું થાય છે કે બોડીની અંદર બહુ જ બધું ઇન્ફેક્શન થઈ ગયું છે અને ઇમેચ્યોર ડબ્લ્યુબીસીસ વધી ગયા છે. અગર શિફ્ટ ટુ લેફ્ટ લો આવે છે, ધ લો, તો એ શું ઇન્ડિકેટ કરે છે કે જે બોન મેરો ડિપ્રેશન હતું એ રિકવર થઈ ગયું છે અને જે ઇન્ફેક્શન હતું એ પણ રિકવર થઈ ગયું છે. સો દેર ઇઝ નો નીડ ટુ ધ બોન મેરો ટુ પ્રોડ્યુસ ઇમેચ્યોર ડબ્લ્યુબીસીસ. હવે ખબર પડી?
યસ, એટલે ડિફરન્શિયલ કાઉન્ટ વધી જાય તો ઇન્ફેક્શન કહેવાય.
યસ, પણ કયું ડિફરન્શિયલ કાઉન્ટ? શિફ્ટ ટુ લેફ્ટ વાળું.
Shift to
આગળ આપણે
left
બીજું
વાળું.
જોઈશું. હા, આગળ હજુ બીજું જોઈશું. સો આટલી વસ્તુ ખાસ યાદ રાખવાની કે શિફ્ટ ટુ લેફ્ટ લખ્યું હોય એનો મતલબ કે ઇમેચ્યોર ડબ્લ્યુબીસીસ વધી ગયા છે. અન્ડરસ્ટુડ?
યસ.
યસ. અને શિફ્ટ ટુ લેફ્ટ લો હોય તો એનો મતલબ
No need to.
યસ, ઇમેચ્યોર ડબ્લ્યુબીસીસ નથી વધેલા. ખબર પડી? Yes. Okay. Next, an increased neutrophil count with a left shift is usually associated with the bacterial infection. કેમ વધે છે? ન્યુટ્રોફિલ કાઉન્ટ કેમ વધે છે લેફ્ટ શિફ્ટ વાળા? જ્યારે કોઈ બેક્ટેરિયલ ઇન્ફેક્શન થાય છે એટલે આપણું બોન મેરો વધારે ડબ્લ્યુબીસીસ પ્રોડ્યુસ કરે છે. તો જ્યારે ન્યુટ્રોફિલ કાઉન્ટ વધારે આવે છે લેફ્ટ શિફ્ટ વાળા, એનો મતલબ કે કોઈ પર્સનને બેક્ટેરિયલ ઇન્ફેક્શન થયું છે એટલા માટે એ વધી ગયું છે. નેક્સ્ટ ઇઝ શિફ્ટ ટુ રાઈટ. પહેલું હતું shift to left, next is shift to right. What does the shift to right means? It means that the cells have more than usual number of nuclear segments found in liver disease, Down syndrome and megaloblastic pernicious anemia. In simple language, shift to right matlab increased WBCs, but this will be
Mature.
mature. Yes. Shift to right means increased number of WBCs, but these are mature WBCs. So it means that the person is having liver disease, Down syndrome, megaloblastic or pernicious anemia. In these conditions, the mature WBCs will be higher compared to the normal. The normal level is normal, yes, 5,000 to 10,000 millimeter cube. In this 5,000 to 10,000, there will be basophils, monocytes, lymphocytes, eosinophils, all will be included in this range. In short, WBCs means બધા જ WBCs આવી ગયા. જ્યારે ડિફરન્શિયલ કરીએ ત્યારે જ અલગ અલગ કાઉન્ટ કરીએ છીએ. બટ જનરલ WBCs કર્યું હોય TLC, it means whole WBCs, all types of WBCs, and this will be between 5,000 to 10,000. When there will be a DLC test, then you will find that shift to left and shift to right because we are doing differential cell count. Understood?
Yes.
Okay. Okay. Elevated values occurs in the following, like inflammatory and infectious process or leukemia. When the shift to right WBC will increase, shift to right means mature WBCs कब increase होंगे? So during inflammatory and infection process, we know to provide the fight, the WBCs will increase. And in leukemia means
Decreased WBC.
yes. So in leukemia, which type of WBCs will be higher?
Immature.
Mature.
Immature, yes. So in leukemia, the shift to left WBC will be higher. So ultimately, in both the conditions, shift to left or shift to right, in which conditions the WBC count will be higher? So during infection and inflammatory processes and during leukemia. In both the conditions, the WBC will be higher, but we should have the differential cell count, that it is shift to left or shift to right. There are mature WBCs or immature WBCs. Understood?
Yes.
Yes. Below the normal values occurs in the following. कौन सी conditions में WBCs कम हो जाते हैं? So, aplastic anemia, autoimmune diseases, overwhelming infection, other side effects of chemotherapy or irradiation. एप्लास्टिक अनीमिया हो जाता है क्लाइंट को, तब भी डब्ल्यूबीसी काउंट कम हो जाता है। ऑटो इम्यून डिजीजेस में, ऑटो इम्यून डिजीजेस में डब्ल्यूबीसी कम होगा या ज्यादा होगा?
ઓછું જ થશે
क्या? वाई?
કેમ કે ઇમ્યુનિટી નહીં ને આપણે જેમ કે AIDS માં તમે કીધું હતું કે આનું રેશનલ તમે કીધેલું જ છે પણ
हाँ, तो yes. So for fighting, for autoimmune disease, autoimmune disease is a kind of disease in which your immune response will act abnormally and will kill the body cells. So for giving defense, the body will require much more RBCs. So why in autoimmune diseases the WBC counts are low?
એ પોતાના જ પોતાના સેલ પર અટેક કરે છે એટલે નોર્મલી ઓછા છે.
No. Any other rationals? Any other tries you want to give? What is the T lymphocyte? Lymphocytes are but WBCs, yes. So WBC increases or decreases? It is a situational. Just like burns can create hyperkalemia also and hypokalemia also. So this is the same thing. Now, any guesses? I have given you one hint. Yes, yes, yes. Online students?
હવે
All
બોડી
in
પોતાના
favor.
ડબ્લ્યુબીસી પર અટેક કરશે એટલે પોતાના સેલ પર અટેક કરશે.
No. Whenever a person is having any autoimmune disease, in initial phases, the WBC counts will be much higher. And that WBC counts, they are giving fight
Own
against
cells.
own cells. Yes.
Yes, ma'am.
But
Yes.
after a time, there is no enough production of WBCs. There is a capacity of bone marrow that the production of number will be limited. Bone marrow cannot infinitely produce a large number of WBCs. So after certain period of time, there will be a lack of WBCs. Same again with overwhelming infection. What is that? Overwhelming infection means, overwhelmed infection means, yes, there is so
બહુ
much of
વધારે પ્રમાણ.
yes, but during the overwhelming initial stage, there will be a much more number of immature WBCs. But after a certain time, if we can say there is no any total mature WBCs are not enough there. So the overwhelming infection can lead to below the level of WBCs. If we can say TLC will be less than 5,000. But if we see the DLC in that, we will see the shift to right and shift to left. In blood test, if you ever get a chance to see the blood test of such patients, read the band score. In that, they will provide you that the mature WBCs are very less. It is below the normal level and the immature are there. So in overwhelming infection and in autoimmune diseases, there will be no more WBCs, mature WBCs will be not there because the bone marrow does not have now capacity to mature the WBCs. Getting my point? Online students, are you getting my point? Or not?
No, ma'am.
Okay. Jayanti, did you get my point or not? So I can understand I have to explain in Hindi or Gujarati.
Yes, ma'am. Please repeat.
Okay, so I have to repeat in Hindi also. Okay. If the patient is having any autoimmune diseases, just for example, give me one example of autoimmune disease. Okay. SLE. If the patient is experiencing SLE, initially the body is producing more number of WBCs to fight the own cells. So in initial stage, the WBC will be more than 10,000. Okay. And they are fighting the body system. But after certain time, bone marrow will produce much more number of WBCs, but those WBCs are immature. So
Immature.
yes, TLC count will be less. We need mature WBCs, not immature WBCs. So TLC count will be less than 5,000 because there is no mature WBCs. But if you will see the DLC, differential leukocyte count in the band, you can identify the shift to left. Shift to left is higher. What does this indicate?
Immature WBC.
Yes, there are more immature WBCs, but there are lack of mature WBCs. So ultimately, the WBCs are less. There is a lack of WBCs. But if you will see the DLC count and in that the band lab test, you can find the shift to left has increased. So this indicates there are much more immature WBCs, but there are not mature WBCs. So the ultimate value of WBCs is less. Understood?
Yes, sir.
Are you getting my point now?
Yes, sir.
All students?
Yes, ma'am.
Yes, ma'am.
Yes. So during chemotherapy and irradiation, it leads to decreased production of WBCs. There is a basic concept. Every student get confused in right to shift, shift to right and shift to left and normal. Simply just remember one thing. Normal WBC TLC should be between 5,000 to 10,000. You will not ask in examination what is shift to left and shift to right. You just need to clear the concept. Normal TLC is between 5,000 to 10,000. If it is mentioned that the differential count is shifted to left, it is high in shift to left. What does that indicate?
Immature WBC
Yes,
count
there are
was
much more high immature WBCs. So, are there mature WBCs? Mature WBCs will be there or not?
No.
So,
no.
yes, what would be the value of WBCs then?
Below
Yes,
5,000.
yes, it would be less than 5,000 because there is no mature WBC. If the if the DLC is shifted, increased in right shift, what does that mean?
Mature WBC વધારે છે.
Yes, there are much more mature WBCs. So what will happen to TLC?
Increase થશે 10,000.
It will also increase it. So you have to clear this concept. Understood now?
Yes,
Yes,
sir.
ma'am.
Okay. The red point, that is so important point for you to remember. Monitor the WBC count and differential closely in the patient receiving chemotherapy because of the risk of neutropenia. Neutropenia places the client at risk for infection. जब भी कोई client कीमोथेरापी पर जा रहा हो, कीमोथेरापी चल रही हो client की, उसका total WBC count and differential count closely monitor करना होगा. Because total WBC count will be less than 5,000, but differential count कैसा होगा? Increased हो जाएगा. Yes, because but the total is less. So it can create neutropenia and neutropenia will lead to increased risk of infection. Understood now?
Yes, sir.
Yes, ma'am.
This is so important. कोई भी पेशेंट कीमोथेरापी पर रिसीव कीमोथेरापी ले रहा हो तो उसका बोन मैरो सप्रेस हो जाएगा. बोन मैरो में से जो नॉर्मल हेल्दी प्रोडक्शन होना चाहिए वो नहीं होगा. सो प्लेटलेट विल आल्सो डिक्रीज, डब्ल्यूबीसी विल आल्सो डिक्रीज एंड आरबीसी विल आल्सो डिक्रीज. प्लेटलेट डिक्रीज हो जाएगा तो कौन सा रिस्क होगा?
Bleeding.
Bleeding risk. So you have to monitor the patient for bleeding risk. You have to monitor the patient for infection and you have to monitor the patient for anemia. So जो भी कीमोथेरेपी ले रहा हो वो तीनों का मॉनिटरिंग उसमें बहुत इंपॉर्टेंट है. Understood?
Yes.
Yes,
Okay.
ma'am.
So This is end of our chapter. We cannot start new chapter now. So we will start new chapter from tomorrow onwards. And the next chapter is nutrition. So let's do a quick revision of our today's class. So today we have seen hemoglobin and hematocrit. What is the normal value of hemoglobin and hematocrit? Okay. Online student, what is the normal value of hemoglobin for male and female?
Male 40 to 80 and female 10 to 60.
Yes. In male, there is 14 to 18 or 14 to 16. In female, it is 12 to 14 or 12 to 16. Then what is the normal value of hematocrit?
For 42% to 52%.
For female.
Male,
Male.
Male. Okay. What is for female?
37
To
to
47.
47.
37% to 47%. Does fasting require for HB and hematocrit test?
No, ma'am.
No.
No,
No. Okay. In which conditions the hemoglobin will be high?
COPD.
COPD.
polycythemia.
Yes, COPD, high altitude polycythemia. In which conditions the hematocrit will be high? Dehydration,
High altitude and polycythemia.
high altitude and polycythemia. Okay. In blood loss, the hematocrit will be high or low?
Low.
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 Because along with the fluid, the blood is also being lost. Only in the conditions when only fluid is lost, in that conditions, the hematocrit will be high. Understood? Below the normal value of hemoglobin, anemia and hemorrhage, yes,
Rage.
because there is blood loss along with the fluid loss. So there will be lack of hemoglobin. And hematocrit value, anemia,
Bone marrow failure. Hemorrhage.
bone marrow failure. Yes, bone marrow is not producing healthy RBCs. Then anemia. Then
Over.
yes, leukemia,
Overhydration.
overhydration. Yes, there is much more of fluid which dilutes the hematocrit. Then we have seen lipid profile test. How many components of lipid profile test are there? Components:
Cholesterol.
cholesterol,
Triglycerides.
triglyceride.
Fat
Phospholic.
phosphorus.
Okay, but types of lipoproteins.
HDL, LDL.
HDL and LDL. There are 4 types of lipids that we are doing the test on a patient. So, if cholesterol is high, what does it indicate?
Can heart problem થશે.
Yes, coronary artery disease. If triglycerides are high, then
એ સારું કહેવાય. કે હોય.
triglycerides.
Also coronary artery.
Coronary disease. Yes. If HDL is high,
એ
It
સારું.
is good cholesterol.
yes,
Good
it is a good cholesterol. It will help from preventing the coronary artery disease. The LDL is high, then
Also
again
good for coronary artery disease.
only HDL is a good cholesterol which will protect our arteries from coronary artery disease or anything. But other types of lipids will cause the harm to the body if it gets excess. So, does any fasting require before doing this test? Yes or no?
Specific cholesterol foods they avoid.
food food and fluid avoid કરવાનું water intake લઈ.
Yes, the fasting is required. In examination,
Water.
there, yes, in examination, you will be given one situation. Okay, patient, there is a risk of coronary artery disease. So doctor is prescribing or suggesting the lipid profile test. Among the following statement, which statement by the patients need further intervention? ऐसा कुछ situation दिया है और patient बोल रहा है कि I don't need any fasting. So, is it true or false? Yes, the patient will require fasting. So, like this type of question can be asked from this portion. So the fasting is required. And what you will advise the patient before doing lipid profile test?
આલ્કોહોલ અવોઇડ કરવાનું 24 hours પહેલા.
Yes, before 24 hours, you have to avoid the alcohol and
હાઈ કોલેસ્ટ્રોલ ડાયટ અવોઇડ કરવું, ફૂડ અવોઇડ
yeah.
કરવું.
But when we are putting the patient on fasting, yes, before fasting, the meal which is taken by the patient should not high in cholesterol or fatty food. Understood?
તો મેડમ ઓલરેડી ફાસ્ટિંગ પર હોય તો ક્યાંથી લેવાનું?
Okay, let me give you the idea. You are advised to take to give the blood sample on what is Tuesday morning. So what you will do in Monday morning, you will take normal diet, but in evening you will take less fatty food or less cholesterol diet. Like you will only eat normal diet, and on your night you will not consume anything. But you have to also keep in mind the evening diet should be not high in fat. Understood?
યસ મેમ, ઓકે.
યસ મેમ.
Yes. ટ્યુઝડે તમારે મોર્નિંગમાં ટેસ્ટ છે, તમે નાઇટમાંથી તો પેશન્ટને એનબીએમ કરી દેશો, ફ્લુઇડ પર જ રાખશો, ખાલી વોટર પર, નોટ ઓન જ્યુસીસ કેવું નહીં, ખાલી વોટર પર. પણ જે ઇવનિંગનું ડાયટ છે એમાં ઇવનિંગમાં પેશન્ટ સમોસા ને એવું બધું ખાશે, સો એ ધેટ ઇઝ નોટ વેલિડ. પેશન્ટને આપણે એડવાઇસ કરવાનું છે કે તમારું જે ફાસ્ટિંગ પહેલાનું જે ડાયટ છે, જે ઇવનિંગ મીલ છે, જે તમે વહેલું ખાઈ લીધું છે, તમારે ફાસ્ટિંગ કરવાનું છે એટલે પેશન્ટ નોર્મલી શું કરે, વહેલું ખાઈ લે. સો એમાં પેશન્ટને એડવાઇસ કરવાનું કે બહુ તળેલું કે હાઈ ફેટી ફૂડ નથી લેવાનું. અન્ડરસ્ટુડ?
યસ મેમ.
હા. Okay. The normal value of cholesterol, HDL, LDL, triglyceride is
કોલેસ્ટ્રોલ less than 200.
Cholesterol less than 200.
HDL.
HDL greater than 60.
Yes. Yes, it should be more than 16. Low density lipoprotein.
Less than 100.
Less than
Yes. And triglyceride.
male by 40 to 160 and female by 35 to 135.
The normal range is 40 to 160, and for female it is 35 to 135. Only HDL is the type of lipid which should be more than 60. બાકી બધા જ ઓછા હોવા જોઈએ. HDL વધારે હોવું જોઈએ because it is a good cholesterol. Others are not good cholesterol, so it should be in a limited range or less than the normal value. But then we have seen in which conditions the cholesterol and LDL level becomes high, in which conditions the triglyceride levels becomes high, then in which conditions the cholesterol and LDL becomes low, and in which conditions the triglyceride levels becomes low. Then we have seen fasting blood glucose. What is the normal range of fasting blood glucose?
70 to 90.
70 to 99. Is fasting required or not?
Required.
Yes. What you will advise the patient before the fasting blood glucose test?
કોઈ
Yes.
hypoglycemic medication નહીં લેવાની, insulin નહીં લેવાની.
Yes. We have to advise the patient not to take any food before 8 to 12 hours. Only water can be consumed, and patient is advised generally to consume the food before 8 to 12 hours. मतलब वैला खाવાનું લઈ લેવાનું. 8 to 12 hours તો તમારે NBM જ રહેવાનું છે, only on fluid, and not to take their medications in the morning also. You have to avoid the food and medications both. After the blood test you can take food and medications both, but before that you have to avoid both the things. Then we have seen in which conditions the FBS becomes high, in which conditions the FBS becomes low. Then next is glycosylated hemoglobin. What is that? HbA1c. What is that?
Average blood sugar of 3 months.
Yes, average glucose monitoring of 3 months. So what is the normal chart for HbA1c? I'm asking for chart. So you have to state all the values.
HbA1c less than 5.7%.
Okay, first is less than 5.7%. What is that?
Normal.
Yes, normal. Yes, normal. Normal. It is normal. Then what is the normal? Again, another chart value.
5.7 to 6.4% હોય તો pre-diabetic.
Yes, if it is between 5.7 to 6.4, then it is pre-diabetes. And
More than 6.5 હોય તો diabetic.
yes, it is more than 6.5, then the client is diabetic. Okay. So this the chart. This is the chart for HbA1c. You have to remember this chart. Three values you have to remember: less than 5.7, between 5.7 to 6.4, and more than 6.5. Elevated values occurs in the following conditions that we have already studied. Below the normal values occurs in the following conditions. Then we have seen the table. From the table, the only thing that you have to remember is the three charts, three categories. Okay. Then we have seen renal studies. In renal studies, the first test was
Creatine.
serum creatinine. What is the advice you will give to the patient?
Exercise નહીં કરવાની, avoid કરવાની excessive.
The patient is advised to avoid excessive exercise before 8 hours.
8
And
hours.
then
Red meat intake નહીં
Red
કરવાનો.
meat
yes,
avoid કરવું.
avoid red meat intake before 24 hours. Okay. Patient ને morning માં Tuesday morning creatinine નો test prescribe કર્યો છે તો Monday morning થી જ red meat નું કશું જ નહીં ખાવાનું. No red meat from Monday morning. 24 કલાકથી red meat બંધ. Okay. Then normal reference interval is for creatinine is
0.5 to 1.2 total combined.
yes, combined it is 0.5 to 1.2. For male, it is 0.6 to 1.2, and for female, it is 0.5 to 1.1. In which conditions the creatinine becomes high, in which conditions the creatinine becomes low, that we have already studied. You have to just remember the rationale. Then next blood test for renal studies is
BUN.
BUN. BUN can directly suggest about the renal function.
No.
No, because it is the not only cause for high levels of BUN. There are many more causes in which the BUN level becomes high. So we should always analyze the BUN and creatinine ratio. What is the normal range of BUN?
10 to 20.
10 to 20 mg per dl. In which conditions the BUN level becomes high, that we have studied. In which conditions the BUN becomes slow, that we have also completed. Then the last blood test was WBC count. Tell me about the WBCs, what we have studied in WBC count. What is the normal range of WBC? First of all, tell me.
5,000 to 10,000.
Okay. Then what are the other concepts that we have completed?
Left shift and right shift.
6 to left and 6.
Okay. Absolutely correct. Online student, tell me about right shift, left shift. What was that?
લેફ્ટ શિફ્ટ મતલબ કે જે ઇમેચ્યોર આરબીસી છે ને એ વધી ગયા છે મેચ્યોર.
So what will be the total WBC?
ઓછા.
Yes.
એ 5,000 કરતા
BSC
ઓછા.
will be less. Yes. Then another concept.
શિફ્ટ ટુ રાઈટ મતલબ ડબ્લ્યુબીસી વધે પણ મેચ્યોર ડબ્લ્યુબીસી વધી
So
જાય.
what will happen to the TLC?
એટલે 10,000 કરતા વધી જાય.
Okay. If the left shift is less, what does that indicate?
કે પેશન્ટને રિકવરી છે
Yes.
સપરેશન
There
નથી એમ.
Yes, there are not increased number of immature WBCs. The patient is recovering from the bone marrow depressions and any infections due to which the immature WBC production has increased. The patient is recovering from that infection. So this is the concept you have to remember. Okay. Then in which conditions the WBC becomes high, in which conditions the WBC becomes low, that we have studied. What is the red point that you have to remember is? Yes. And due to chemotherapy, there is a risk of
Neutropenia.
neutropenia. So, neutropenia ના લીધે શું થશે? Neutropenia.
ઇન્ફેક્શન નું રિસ્ક.
Infection. Yes. So we have to take infection precautions. You have to remember which are the infection precautions. We have already studied this in oncological chapter. What are the infection precautions? So you have to remember this. In exam, you will be also asked in such a way that patient is neutropenic. So what interventions you will do? So you have to understand that patient is neutropenic. Then I have to take the infection precautions. So which option matches the infection precautions? So this is how you have to select the correct options. Any doubt in this?
No, ma'am.
Okay. Okay. So see you tomorrow at 9 a.m. And from tomorrow we will start new chapter, that is nutrition. Thank you.
Like,
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.